I think I have testicular cancer.
I don't think that's possible, Tyler.
But Google says that I do. I have the signs. I have an aching in my belly. My breast tissue is tender. I have back pain and fatigue.
Maybe you shouldn't trust Google, as their symptoms relate to many things, from a bug going around to carrying too much stuff in your bag.
It affects 1 in 270 men. I could be that one.
Okay, well, let's think about this. Does your family have a history of testicular cancer?
No.
Do you have AIDS or HIV?
No.
Also, there's one major thing you've forgotten.
What?
You don't exactly have, testicles.
I don't?
You're a trans man, Tyler. Testicular cancer can affect trans people, but it's only trans women or people born with male anatomy, and you weren't born with male anatomy.
Oh yeah, I forgot about that part.
The whole thing about testicular cancer is how it affects the testicles. It's caused by a tumor within them, and since you don't have testicles, you can't exactly have a tumor there.
You have a good point. I guess I panicked without properly doing the research.
Yeah, but if you really are concerned, speak with the doctor. They can do the proper blood tests and or ultrasounds.
Wait, but aren't ultrasounds for when someone's pregnant?
For the most part, yes, but they can also be used to identify certain cancers.
Wait, so how do I know it's not something else?
Well, for starters, there would be an enlargement of the scrotum, and in later stages it could start losing control of limbs, eye movements, and speech from an autoimmune disease sometimes caused by tumor.
Yeah, I really don't want that. Thankfully, the cases seem to have gone down by 13.7% in 2020. But so has the survival rate. It went down from 100% to 97.7%. What if I'm that 2.3%?
Since that's from 2020, it was most likely affected by COVID. However, it still has a higher survival rate than most, which makes sense because it affects older people ages 30 to 34, and those years are usually when they're the healthiest.
Still, if I did end up with it, and I was considered an at-risk patient, I would only have a 50% chance of surviving the chemotherapy.
Well, it's a good thing you don't have it and aren't an at-risk patient. And even if you did somehow have it, it's because you aren't at risk, you would have a 95% chance of survival.
Those are good survival rates. Even though people have a good chance of survival, I still feel bad that they have to deal with the stress and pain. They deserve to have some kind of recognition.
They do. Testicular Cancer Awareness Month is April, and they're represented with an orchid ribbon. On top of that, more awareness is spread because famous people have had it and shared their experiences, some including Lance Armstrong as a cyclist and Tom Green as a comedian.
Wow, it's great that more people are becoming aware of testicular cancer. Though, if I don't have it, I wonder what I do have.
You're most likely fine, but then again, Google says you could have ovarian cancer.
Wait, what?